I want to know what I can do to make my eyes look fresh and young. The hollowness and half circle really bother me. My eyes always look tired. I try my best to hide the problem with makeup, but it still shows. They are hollow and simply do not look like the eyes of a 33-year-old. I have excess skin that makes a half circle from the top of my lid, coming to the sides of the nose and under my eye. Please let me know what can be done to fix this problem. It is really disappointing every time I look in the mirror. I want to be able to go outside without makeup, but can't because of my eyes. Please help.
Thank you for your question. You're 33 years old, and you describe in a lot of detail about your tired-looking eyes and how, even with makeup, they still look tired. You describe some half circle of skin that extends to your nose and the upper eyelids and the hollows of your lower eyelids. You've submitted 2 photos that are very useful and certainly gives me a good sense of your current appearance. So, I'm a cosmetic oculofacial plastic surgeon. I specialize in eyelid surgery, facelifting surgery, and so rejuvenating tired-looking eyes is very much what I do every day. So when someone like yourself comes to us, we first try to learn a little bit about why your eyes look so tired. There's the anatomic issues that we'll address in a moment, but I would want to also know, are you a smoker? If people who smoke tend to accelerate the aging process, smoking is incredibly destructive to fine, delicate tissue in the body. Do you have seasonal allergies? Are you rubbing your eyes a lot? Are you under a lot of stress? So putting the systemic issues as one contributing factor and maybe figuring out a way to manage that. If you're a smoker, then stopping smoking clearly is to your advantage. The other parts of it have to do with lifestyle, sleeping enough, and diet and exercise. Basically, things that are good for your heart and lungs are also good for your face and your eyes. Now, with those things being put aside, and let's say those are all are fine, that you sleep enough, you exercise, and you don't smoke, and you have no issues with allergies, then most likely what you're dealing with is a genetic issue. So let's start with what is the dominant issue from my perspective. To me, the under eye area really communicates the tiredness. For years, we always hear our patients say, "I'm tired of looking tired." And so the puffiness under the eyes, I would say, is the most significant issue. That doesn't mean that the hollowing that's below the puffiness is not significant. But when you think about the hierarchy of issues that are contributing to the tired look, I would say the puffiness is on top. So what is the puffiness? Well, the puffiness is most likely something called lower eyelid fat prolapse. Lower eyelid fat prolapse means that the fat that's normally around the eyes pushes forward and creates these bulges. Now these bulges result in a constant look of fatigue. And even if you use creams and you mention makeup or other types of non-surgical modalities, they simply won't work. In our practice, someone like yourself would be treated with a procedure called a transconjunctival blepharoplasty. This is a method of addressing the fat pockets from the inside of the eyelid, and this way we're able to avoid an external scar, no sign of any procedure done from the outside, and no one would know that you used to have the puffy bags. We also often combine this procedure with modalities such as platelet-rich plasma, which is deriving the key growth factors and healing factors from your blood to stimulate new collagen and to improve the skin quality under the eyes. We also use thermal energy, such as the use of a fractional CO2 laser, to help improve the external skin quality. Chances are we would also add to your regimen some topical skin products that basically you need a good moisturizer, you need a good sunblock, maybe something for cell turnover such as a retinol product. Now, that being said, other areas of relative hollowing can be addressed, but I usually defer that till after the surgery. I feel like when you take away the biggest negative, it's changing the architecture enough that you can look at yourself from a different lens or a different filter and understand what is your priority from that point on. So I think it's best for you to meet with qualified, experienced cosmetic surgeons and learn about your options. When we perform the surgery, we perform this procedure in our Joint Commission approved facilities within our practices in Manhattan and on Long Island. And we do this under local anesthesia with light IV sedation. This means we avoid general anesthesia altogether, so our patients are able to recover quickly and go back to work as early as less than 1 week. So, moving forward, meet with doctors, get some opinions. I know I didn't address directly the upper eyelid skin. Although from my perspective, with your eyes open, there doesn't appear to be that much redundancy to the point where there's hooding. So in terms of the relative contribution to the fatigued appearance, I would say focusing on the lower eyelids and will be a good way to get the most value, especially if you have limited resources, and applying these limited resources strategically. I'm not making assumptions. I'm just I always counsel my patients of the wish list, what will give you the best value for what you want to achieve. So I hope that was helpful. I wish you the best of luck, and thank you for your question.